Have you ever wondered how to use a digital blood pressure device? Perhaps you've been asked to monitor your own blood pressure at home, or maybe you're just curious about how these devices work. Either way, understanding how to use a digital blood pressure device can be a valuable skill. Firstly, it's important to understand what a digital blood pressure device is. It's a modern tool that measures blood pressure, the force of blood pushing against the walls of your arteries. It displays the readings on a digital screen, making it easier to understand and record the results. The process begins by finding a quiet and comfortable place to sit. Ensure your feet are flat on the floor, with your back and arms supported. Rest for about 5 minutes before starting to get the most accurate reading possible. Next, roll up the sleeve of your left arm, or remove any thick clothing. The device's cuff needs to be placed on bare skin for the most precise results. Wrap the cuff around your upper arm, ensuring the bottom edge is 1 inch above the bend of your elbow, and the tube runs down the center of your arm. Once the cuff is in place, press the power button on the device. Some devices automatically start taking a reading, while others require you to press another button. As the device inflates the cuff, you'll feel a tight squeeze. It's crucial not to move or talk during this process, as it might interfere with the reading. Once the cuff fully inflates, it will slowly deflate. As this happens, the device measures the pressure in your arteries and displays 2 numbers on the screen: your systolic and diastolic blood pressure. The top number, your systolic blood pressure, represents the pressure in your arteries when your heart beats. The bottom number, the diastolic blood pressure, represents the pressure in your arteries when your heart rests between beats. After the reading, gently remove the cuff and turn off the device. It's recommended to take 2 or 3 readings, each 1 minute apart, to ensure accuracy. In summary, using a digital blood pressure device involves the following steps. Find a quiet place to sit and rest for 5 minutes. Position the cuff on your bare upper arm, 1 inch above the elbow. Press the power button and remain still and silent as the device takes a reading. Once the reading is complete, remove the cuff and turn off the device. Repeat this process 2 or 3 times for the most accurate results. Remember, while monitoring your blood pressure at home can be a useful tool in managing your health, it should never replace regular checkups with your healthcare provider. And if you ever have concerns about your blood pressure, reach out to your healthcare provider